Next Round with the Pacific Research Institute. I'm your host, Romina Ichon. This week we have two guests. Yes, the issue is that important. We're talking about vaccines, and if you haven't had one yet, by the end of this podcast, you'll be running out the door to get one. Tim and I, PRI's Director of Communications, chats with Dr. Henry Miller, PRI Senior Fellow in Healthcare and a medical doctor, on the medical facts of vaccinations and the need for further innovation. We also have Wayne Winegarden, PRI Senior Fellow in Business and Economics. Tim discusses with Wayne the economics of pricing and delivering vaccines and why reforms are needed so that more Americans have easier access to vaccines. Thanks for joining us.
Well, Henry Miller, welcome back to PRI's podcast. It's great to have you back again.
Good to be with you.
I think it's appropriate, as I have some sort of cough or bug in me, that we're talking about the flu season and vaccines. So I was very interested in a recent column that you wrote for foxnews.com on this year's flu season. Maybe let's begin with what we're facing in this year's flu season. What are the risks facing Americans, in your view, if they don't get a flu vaccine this year?
Well, Tim, first of all, I can tell you with some assurance that you don't have the flu, the real flu, because if you did, you'd have a raging sore throat, a high fever, muscle ache, and you'd feel really, really terrible. You probably wouldn't be up for doing this chat. The last year's flu season was the worst in many years. It killed roughly 80,000 Americans, according to the CDC, caused 900 hospitalizations, and it was really costly in human terms and economic terms. That was a very bad year, and that was a function partly of the vaccine not being a terribly good match for the predominant strain of flu that was circulating, and also the in a related issue, the mode of production of the predominant vaccines, which caused the match not to be terribly good. So it's difficult to predict what this season will be like. As of November 3rd, when the last data were available from the CDC, there was relatively low flu activity in most of the country. Georgia was the only state that was showing moderate flu activity at that time, but it's still early in the season, and we can expect it to rev up significantly over the next month.
One of the common complaints about last year's flu vaccine is that it didn't work, and as I can attest from the fun that I had over New Year's weekend being down for the count with the flu, many folks who got the flu shot got the flu even though we lined up at Rite Aid or CVS to get our shots. So inasmuch as you're a physician and you used to do research on the flu virus, could you talk a little bit about the science of vaccines? For example, with last year's formula not being very effective, how can we encourage more research and innovation for vaccines like the flu vaccine?
The flu virus is different from many others that we commonly see, measles, German measles, that's rubella, and so on, in that it's constantly mutating. And so the flu virus that we see from season to season is different and can be very different. So the normal mutation and variation that we see is called genetic drift, and that occurs routinely. What we are most fearful of in the public health community is what's called genetic shift. That's a major change where we're seeing a strain of a flu virus that we haven't seen before and that we don't have any immunity to at all, and for which, therefore, the vaccines don't work because we can't predict those shifts. And that causes pandemic. That causes major, widespread, severe illness and death in this country and worldwide. Last year's strain was a shift. It was a variety called H3N2. And H3N2 is notorious for the vaccines not being terribly effective. One reason is that most flu vaccines are produced in fertilized chicken eggs, in tens of millions of chicken eggs, as something like a 70-year-old technology. And there are slight changes that occur in the virus as it's being grown in the eggs for vaccine purposes, and that makes it more different from the circulating viruses. And so the vaccines for H3N2 often don't work very well if they're produced in eggs. So that's one reason. Now, what we should do, is to produce vaccine with a better technology. And some of the vaccines available this season are, in fact, produced in what's called cell culture. And these are cells that have been derived from animals and propagated continuously in laboratory, in manufacturing facilities, cultured, and that's called cell culture. And these grow the vaccine viruses with greater fidelity than eggs do. Some of these are genetically engineered to be more effective. Bill, addressing one of those myths that you hear, people say, I got the flu shot and I got the flu. Flu vaccines do not cause the flu. Only one of them, which is administered intranasally, actually contains weakened live virus. The others do not contain live virus and cannot cause flu. The other point that I wanted to make regarding what you said about you and others having gotten their flu shot dutifully last year or any year and then getting the flu anyway, is that even when the flu vaccine doesn't absolutely prevent contracting the flu, it does blunt the effects. It does attenuate it. And so characteristically, the illness is shorter lasting and much less severe. And so that can be the difference between spending 3 or 4 days in bed and ending up in the emergency room or the ICU or even the morgue. So in any case, in any year, it's essential to get that flu shot. And there are a number of varieties that we can talk about if you wish, about number of kinds that are available, and vaccine providers can match them to your age and your clinical situation and so on. But it is very, very important to get that shot.
Our listeners, despite the convenience of getting a shot at your local Rite Aid or CVS, might be concerned about, having a pharmacist do it rather than a doctor or a nurse. So could you talk a little bit about what kind of training pharmacists receive on administering vaccines?
Well, there are a number of aspects to that question. One is that they do receive a training course, a short training course in how to administer it. And if it's given in the traditional way with a needle and administered intramuscularly, you need to give it in a certain place in the deltoid muscle in the upper arm. It's not difficult. It's not rocket science. But in addition, there are a couple of alternative ways of administration that are really virtually foolproof. So one is the intranasal inhaled vaccine, which is available, I think, for people from age 6 to age 49. And that was not available last year. It was not felt to be effective. CDC says it's a good vaccine this year. So that's an alternative. There's another technology called a jet injector that shoots a high-speed, high-pressure stream of liquid through the skin, and it is needle-free. So that's another alternative if you have any qualms about pharmacists administering it. But I don't have qualms about pharmacists giving it. Through the American Pharmacists Association, they give refreshers each year, and it's quite a safe and, as you say, a convenient way to get the shot or the inhaled vaccine.
So let's broaden the discussion a little bit. I can see why busy adults might skimp on getting vaccinations for themselves, but now more and more you're seeing parents foregoing vaccinations for their kids. And we're seeing that vaccine exemption rates among infants and school-age children have been rising according to the new data from the CDC. And you're seeing misguided celebrities and a lot of false information floating around on the internet convincing many parents that vaccines might cause autism. So, can you share with our listeners some of the latest research here?
Sure. First, let me say that I'm as libertarian as anybody, but I don't think it should be an option to have your children forego the full vaccination schedule recommended by the Centers for Disease Control. It puts them in danger. It puts in danger other kids who, for medical reasons, cancer impaired, immunological competence, might not be able to be vaccinated, and it's a real threat to society. There are some communities, mostly, I have to say, left-wing elite communities, where the non-vaccination rate is very high, and that's a tragedy and a travesty. Vaccines are the single greatest contribution to public health in the last 200 years, and it's tragic when we don't take advantage of that. The vaccines today are high quality, they're safe, and generally extremely effective. The other point I want to make is that when you contract the flu, you've caught it from someone, and it can be through someone sneezing or coughing and the droplets that are produced in that way, or it can be from picking them up from a surface, an elevator, a button, a doorknob, and so on. And so the more people who are vaccinated, the less likely it is that there will be transmission, because vaccination creates a kind of biological barrier to the spread of infectious diseases, including the flu. So I think it's highly irresponsible to opt for, quote-unquote, philosophical reasons not to have your child immunized appropriately. Fake news about vaccination and other scientific issues that we all hear about from know-nothing celebrities is just an unfortunate and concomitant of social media and the low quality of vetting of information on many cable networks these days.
So one of the wildest things that I saw in my time working in the legislature was when we had the debate over mandatory vaccine legislation in the Assembly and Senate. You really did see that kind of odd coalition of the far left and the far right joining forces to fight mandatory vaccine legislation that ultimately was signed into law here in California. You saw this year that one state senator, the author of that bill, Senator Richard Pan of Sacramento, actually faced a stronger than expected challenge on the left this year because of his strong advocacy for mandatory vaccines. He's a doctor, as an aside. So what are your thoughts on these legislative efforts and the pushback that they're getting?
Well, as I said, I'm generally as libertarian as anyone, but I believe in compulsory vaccination. As you suggested, it's an odd coalition of the far left who are generally anti-corporate and think that there's this sinister conspiracy between regulators and legislators along with industry. And then there are those on the far right who the tin hat conspiracy crowd who believe in chemtrails and again, conspiracies to sap our vital juices, as they said in Dr. Strangelove. But whether the far left or the far right, I think opposition to mandatory vaccination is misguided. I think both for the benefit of individuals and of society as a whole, there are certain limits to individual choice and libertarianism. They're my own views, of course.
So finally, what do you say to Americans who may be leery about getting a flu shot this year, given last year's ineffective shot?
Well, this year's is updated. It contains 4 different varieties of flu virus as opposed to 3 last year. It's going to be H3N2 predominantly again, we think. There are special formulations for those over 65, and these are going to be the best vaccines that we think we can produce given current technology. So get the shot. And at worst, it will likely attenuate or blunt the severity and length of the illness should you contract the flu. There's one other point I want to make. There are 3 good drugs that can both prevent the flu and also limit the severity and length of the illness. One is a pill, one is an inhaled fine powder, and the other, quite recently approved, is an intravenous drug. And these can be very valuable if you find yourself in a situation where the flu is raging in your community and you're particularly susceptible because you're elderly, because you have what are called comorbid diseases, that is, other illnesses like diabetes or inflammatory bowel disease or cancer that predispose you to complications of the flu. And there are adequate supplies of these currently, and people should feel free to ask their physicians to prescribe them if they feel they're at high risk and there's a lot of flu around. So there are things that you can do to prevent you and your families from becoming sick or ending up in a hospital or worse during this current flu season.
Well, Henry, hopefully our listeners take your words to heart and go out and get themselves a flu shot this week. Thank you so much for joining us and really enlightening our listeners about the importance of getting a flu vaccine.
Thank you, Tim. It was a pleasure.
Welcome to Next Round, Wayne.
Thanks for having me, bro.
So it's flu season again, and last year's flu season was an especially bad one. More than 80,000 Americans died and 900,000 people were hospitalized, making it the worst flu season in decades. The fact is, in the U.S., vaccination rates remain pretty low. And Wayne, when you did your paper, how about giving us some of the disturbing statistics that you found?
Yeah, when we talk about vaccinations, there's 2 things to differentiate: the kids' vaccinations and adult vaccinations. And when you talk about adult vaccinations, you're talking about things like flu, pneumonia, shingles, a lot of these important kind of vaccines to help keep the population healthier. And the rates, even at the flu, which I think is the one people are most familiar with, we're still under 50% of our adult vaccination rates. Pneumonia for people over 65, it's a bit over 60%. And so these are inadequate vaccination rates. We're below kind of what the CDC has set for what the healthy people 2020 kind of our goal. And we're below those target levels for all of these vaccines. And the consequence is you're talking about almost 1 million people getting pneumonia every year, talking about, about 500,000 hospitalizations, 19,000 deaths. And, the flu, the same thing. You talked about 80,000 deaths. And all of these are preventable if we can increase our vaccination rates.
So while vaccination rates are low in general, in minority populations, it's a real problem. And we're seeing that vaccination rates are even lower than average. So what did you find when it comes to vaccinations and the African American and Hispanic communities?
No, exactly that. Look, when you look at both flu, when you look at pneumonia, both the African American community and the Hispanic community, we talked about there's inadequate vaccination rates for the population. They're even worse in those communities, and it's troubling because it's exposing the African American community and the Hispanic community to greater risks from these diseases, more costs, and obviously hospitalization. All of these kind of adverse outcomes that can be prevented are going to be kind of manifested more in these minority communities, and we need to do something about that.
Wayne, your study, which just came out earlier this year, focuses on the laws governing who can administer vaccines. So just this past weekend, I walked into my local Rite Aid and I got a flu shot, and PRI's insurance thankfully covered it. But some people might not have this kind of access. So who can administer vaccines and who can't? And are there differences in who can do so in each state?
Yes, there are differences across the states. I mean, right now, all the states permit to some degree to allow pharmacists to administer vaccines. And it varies depending upon, some states will say, oh, we want the physician to require a prescription before you can go to the pharmacist to get a vaccine. Others are going to have very strict rules that make it inconvenient. And the problem is the whole point of having pharmacists able to administer the vaccines is to make it more convenient. These are qualified health professionals who have probably the ability to administer these vaccines. They can do it for less cost. They can do it more conveniently. We're talking about location, hours, all of these kind of factors built into this more convenient place to kind of administer the vaccines. And we have the states, many of which are imposing kind of requirements that completely undermine the whole point of allowing pharmacists to administer the vaccines. And so we need to create some sort of federal standard that we can actually kind of better empower pharmacists to increase the vaccination rate because of how serious it is and how important it is to have a well-vaccinated kind of population.
Flu vaccine rates have the highest levels because they're the most accessible, but other vaccinations, such as the shingles vaccination, are much harder to get and they're more expensive. So how would reform make getting vaccines like the shingles vaccine more convenient?
The reforms would quite simply kind of lower the costs, right? I mean, there's a lot of barriers in terms of vaccines. I mean, nobody likes needles, right? So you automatically, whenever you say, oh, we're going to have a vaccine and it's going to be administered by a needle, I think most people, myself included, you're like, I'd rather not get the shot. And so you have that predisposition that's out there. And so if you have to go to the doctor and set up the appointment, and it's a much longer kind of process, which of course makes you have more time to chicken out and not get the vaccine. The more you can make it convenient and lower the costs, the easier it's going to be to vaccinate more people. And you talk about issues like the shingles, where our vaccination rates are very low compared to flu, compared to pneumonia. Anything we can do that would lower those costs, that would increase the vaccination rate, help us move towards those goals that will just improve overall public health.
So, Wayne, I actually, when I went to visit a physician, I asked for the inhaled version of the vaccine. So you can ask for that. And I think it's the same. Well, our insurance paid for it, but there is a version that you can inhale. One of the areas your study explores is cost. How do costs for vaccines compare at a doctor's office versus a pharmacy? And what explains the cost differences?
That's, I think, one of the more important questions when you talk about pharmacies. Compared to physicians' offices, compared to other medical settings like hospital outpatient or the emergency care facilities, pharmacies are just cheaper. They're cheaper when you look at kind of all the studies and comparing shingles vaccines to pneumonia vaccines to influenza vaccines. Across the board, pharmacies were a cheaper place cost-wise to administer the vaccine. And I think a lot of that just goes to basic economics. When you talk about economies of scale, those types of kind of micro issues, there's just advantages in terms of holding the vaccines in storage, right? Most doctors' offices, they don't carry most of the vaccines that the CDC recommends simply because they don't have the volume or the kind of the space to carry all of those. Whereas a pharmacy, you can, by kind of consolidating people together, you can get the foot traffic that makes carrying all the vaccines achievable, more cost effective. And so that, I think, gives some basic comparative advantages. And kind of that's one of the things kind of writ large we need for the healthcare sector, which is have the right healthcare professionals kind of do what their comparative advantage is so that we can improve the efficiencies, improve health outcomes, and control costs better. And so that's just, when you look at vaccines, it just, for many patients, the pharmacist is just the more efficient kind of location to be getting that done.
So finally, Wayne, based on your findings in the book, what specific reforms do you recommend that states and the federal government adopt to make vaccines more convenient and affordable?
I think the most important reform we can do is take the lists of vaccines, the adult vaccines that the CDC recommends, and pharmacists should have the ability to independently kind of screen, access, and administer those vaccines without having some special extra, what they call a protocol protocol in order to kind of administer the vaccines. There should be no required prescription from a physician. So if I want to get the shingles vaccine at the pharmacist, I shouldn't have to go to my doctor to get a prescription for the shingles vaccine, and then I can go to my pharmacist and have it administered. Obviously, we're counteracting the whole benefit that the pharmacy would provide. So I think that is the core part of the reform that needs to be done. Other kind of important kind of aspects to it is, one, that we need kind of a streamlined, nationally consistent reporting requirement, and that's just basically we need to lower the regulatory kind of burdens on pharmacists as well as the doctors to make complying with the regulations as easy and cheap and unburdensome as possible. And as part of that, in order for this to work well, the pharmacists need to have access to the patient's vaccination history once they can educate patients in terms of the benefits of the vaccines. Right, the pharmacist knows that you haven't received a flu vaccine or the pneumonia vaccine or the shingles vaccine. They can actually educate patients, and that's one of the kind of advantages we've seen with pharmacists playing this role, is that they play a very important education role. So we need to empower that so that the pharmacists can become kind of a more effective part of the healthcare team.
Thanks, Wayne.
Thank you.
Thanks again to Dr. Henry Miller and Wayne Winegarden, as well as Tim and I. Dr. Henry Miller and Wayne Winegarden's research can be found on our website at pacificresearch.org. And while you're there, check out our blog, Right by the Bay. If you like this episode, please tell your friends and subscribe to PRI's podcast at iTunes, Google Play, Stitcher, or TuneIn. And please do us a favor and give us 5 stars. You can also listen to our podcast on PRI's YouTube page, youtube.com/PacificResearch1. That's the number 1. Thanks for listening. I'm Rowena Ichon. We hope you'll come back again for next round with PRI.